Hi, welcome to the Fibromyalgia website. You've come to this website because either you or a loved one is suffering with a condition where they don't know how to put everything together to call them something other than fibromyalgia. And fibromyalgia means pain in the muscles and connective tissues of the body. But not all fibromyalgia patients, or those who've been labeled with fibromyalgia, actually have the exact same symptoms. We're going to go over some of that in just a moment. And I'm going to help you understand some things about this. We're also going to understand in these videos, you'll understand at the end of these videos, what makes us different from every other doctor you've seen for your condition. And what you've got to understand is you need to be treated, you need to be diagnosed and treated metabolically and neurologically. It's very important. You're on this website again because somebody suffers with this and you want to find out more about fibromyalgia. And I'm here to tell you that no stone is left unturned in this office to determine what's causing your problem and to help you fix your problem to get relief of your condition. Let me tell you who I am and what I do. My name is Dr. I practice functional neurology. I went to school to become a chiropractor. I realized that chiropractic alone could not help people with this debilitating fibromyalgia condition. That I heard what other doctors said and I started believing that it was all in your head and it was the person's problem. It couldn't be me because my techniques and my chiropractic was better than somebody else's down the street. And I was wrong. And a couple of years ago I met a Dr. Johnson, who is a board-certified chiropractic neurologist. I met him at a seminar and he said, try these different methods and things. I'm going to make this story very short. Try these different methods, and I started seeing them working with patients in my practice. So I went back to school. I'm getting a PhD in functional neurology. I've also been trained in functional blood chemistry analysis, functional immunology, in functional gastrointestinal assessment, and functional endocrinology, brain and neurotransmitters. I don't just look at a patient with fibromyalgia and say, okay, I know they have fibromyalgia and that's what we're going to treat or that's what we're going to try to help them with. I take a step back and I look at the whole picture. The only way to really understand what's going on with you is to do that. Patients come in here with these different labels, these different labels of a condition like fibromyalgia or whatever else is they're being told out there, or depression, and it really doesn't tell us what's going on. Fibromyalgia in medicine is kind of a medical mystery, and it's got to be understood, and we're going to tell you how we do that here. There are specific metabolic treatments. I'm going to go down a list of things that we do in order to be able to help you understand what's going on with your body. We start out by looking at intestinal system function. And your intestinal system is very important to understand because you have a barrier system in your body, and it's called the gastrointestinal barrier system. And when that barrier becomes compromised for certain reasons we'll get into, it stresses the brain function, it stresses the immune system function, it stresses the endocrine system function. You have one major system that runs your body. It's called the neuroendocrine immune axis. And whenever there's a stress in any of these organs and they're not functioning well, it may cause an immune system stress, that causes a hormonal stress, that stresses the brain and the whole nervous system function. We can go into that more in detail in person. What we've got to understand is we check for reactions to food sensitivities. People with fibromyalgia commonly tell me, I feel bloated all the time, I feel fatigued all the time, I can't sleep, I feel pain, I feel cramping, I feel like I'm going to vomit, I have diarrhea, I have irritable bowels, I have constipation, I have headaches, I can't sleep, I feel burning, I feel like I want to get out of my skin, I don't feel good. What we've got to understand with all of these pressure points and all these trigger points, as they're commonly called, people have reactions going on in their intestinal system. We have reactions to foods that we test through the stool analysis, where we look for dairy sensitivities, not lactose problems. You can't be lactose intolerant and just drink lactose-free milk. You've got to look for proteins that are found in the milk. We check for dairy, we check soy, we check eggs, we check corn, we check gluten, we check yeast. We even check for a DNA type in your intestines. We look for a celiac disease. We're looking for enzymes that are eating away at the intestinal tract. If you've never done this test, you're missing out on the big picture. It is not about just taking a drug called Lyrica or Neurontin which are anti-seizure medications, folks. They're not made for fibromyalgia. Now, they may help some people, but others who come into my practice who suffer with fibro, and if you're watching this website, obviously you or your loved one's still suffering, those medications may not be helping you, and they're never going to help you because you're not suffering from a seizure. Okay? So we check for sensitivities to foods. And whenever these conditions making your fibromyalgia worse, it causes inflammation of the brain. The brain can't function normal. We check for intestinal permeability. We check for a couple of things with the intestines. Intestinal permeability is called leaky gut syndrome. And when we have these cells in our intestines that are so tightly woven together, when they're stressed from reactions to foods, or from parasites, or from yeast, or from fungus, or from immune cells that are flared up causing stress in the intestines, those intestines kind of split apart and they become what we call leaky gut. And parasites or bacteria or food substances that are stressing our system get through, they get into the bloodstream, they go up to the brain, and they stress the brain. And they can cause headaches, they can cause dizziness, they can cause insomnia problems, they can cause fatigue problems, they can cause irritability problems, they can stress every part of your system. So we've got to check the intestines. We've got to see if you have bacteria. We've got to see if you've got parasites. We've got to see if you have enzyme problems in the intestines. We've got to check your intestines completely. We want to know if that intestinal system is permeable. We're going to have to retest it after we start treating you and repair it. Now, my treatments are not medications. I'm not here to tell you to get off medications. And legally, I can't practice medicine by telling you get off of what your doctors are giving you. But we will completely assess what you're on. We're going to completely assess you through what we've already talked about through stool testing to understand if there's a DNA problem in your intestines, to understand if you're having reactions to these foods. We'll understand more. Some of the symptoms that will happen from these intestinal problems are chronic pain or fatigue, frequent indigestion, bloating, loose bowels, constipation, mouth ulcers, people vomit a lot, migraines. These can happen all because of intestinal problems caused by foods, parasites, and things that you've got inside there. Then we also run, as I've been trained, on a very comprehensive functional blood chemistry analysis. And through functional blood chemistry analysis, we run a complete thyroid panel. There are so many, I've met so many fibromyalgia cases that come in my office who tell me I'm on Synthroid, I'm on Armour, I'm on this kind of thyroid medication. And my thyroid never looks normal, so they keep giving me a little more of the Synthroid. They're giving me a little more of the Synthroid. The doctor's trying to regulate it and find what one patient told me was they're trying to find an equal balance. They're not going to find it, folks, because they're not running a complete thyroid panel. You can't just run 2 or 3 thyroid markers. You have to run a complete 8-marker specific thyroid marker panel, including thyroid antibodies. Thyroid antibodies called TPO antibodies and TGB antibodies. If you're not running those, you don't know if you have a condition called Hashimoto's thyroid. That's got to be understood in detail. Otherwise, you can't treat it properly. And commonly, and I'm not here to talk bad about any medicines, but I want to let you know, there are sometimes patients may not be okay with the one kind of thyroid medicine that they've been given, or they need something that's more natural thyroid glandular support. That can be done, but we can assess that properly. We run a complete metabolic panel, lipid panel. We're looking at CBC with autodifferential. We're going to understand liver function. We've got to run a liver detoxification test. We need to know if your hormones are being regulated properly in the body through the liver. We've got to run blood sugars, functional blood sugar analysis. You can't just look at the highs and lows on the labs. You've got to look at a functional range. What do I mean by that? The laboratories take all of their patients that they're seeing, millions of people who are being tested with their blood over the year, and they take whether they've got GI problems, fibromyalgia, hormone imbalances, diabetes,